Welcome to Field Notes, Insights from N2PH Alumni. N2PH Health is a year-long workforce training program for those who are new into the field of public health. I'm Juliana Mansky.
And I'm Mackenzie Legal. We are program facilitators and hosts of this podcast. With a vibrant community of over 400 current and past residents, N2PH Health is a wealth of knowledge and experience in the public health field.
In each episode, we'll share inspiring stories and valuable insights from those who've journeyed into public health, highlighting their unique path and the impact they're making.
Joining us today is Mardie Hawkins. Mardie is a senior community liaison with the Diabetes Awareness and Wellness Network at the City of Houston Health Department. Mardie graduated from the N2PH Health residency program in September of 2024. Mardie, we are so excited to have you here today. Can you tell us more about your journey into public health?
Thank you for having me. I'm glad to be here. This program has definitely been a game changer for my career. Can't talk about the journey unless I give just a brief background on how I even got to public health. Growing up in a community where the resources were limited, I learned to always be about community. I also learned that the community is where you get your resources. Somewhere down the road, the resources have been drained out of our communities, whether it's been lack of historical markers or boundaries, gentrifications, lack of access, and just numerous things over the years. So after 20 consecutive years in healthcare, I decided to pursue my career in healthcare management. And while pursuing this, I have had the opportunity to work at various organizations and alongside some outstanding physicians. But I also have had the opportunity to collaborate and build relationships with many different healthcare providers and community members and leaders. So I know firsthand how effective and contagious having eye care values are. And so it is my quest for personal accountability that led me to public health. And it started basically during the pandemic when everybody was shut down, and as even clinics and some of our other healthcare facilities, I found myself, while at a private institution, still kind of in a position of doing public health work because I was on the other end of the phone having to answer questions that my institution and providers had some of the answers to. And it didn't matter who was calling, where they were calling from. All that mattered was that they received the information. And with this, where I should have been burned out, exhausted, and tired from all the phone calls, I wanted to stay there for the next caller. And that's when I figured out I wanted to not just live in the community, but be a part of the community and give back my talents to the community. Just being there and being able to educate the community and share knowledge and provide resources to them, it just kind of put me on this path.
That's really powerful, Mardie. We need more people like you who really want to be actively involved in helping and being a part of their community. Can you talk about how you found the N2PH Health program and when you came to that?
Yes, of course. With my job here as a senior community liaison, I was given the opportunity to actually attend the NACHO conference in Denver, Colorado. And that is where I first learned of the new to public health program. I was going around to the different vendors, I tables, and I ran into Juliana, and we had a conversation. And I had been in my role about 6 months, maybe. And so I still had a lot of questions. And in having a conversation with her, I just realized that this was my opportunity to take a deeper dive into what public health is and what it means. So even though I was currently working in the role, there was still some missing pieces to the puzzle. So just in having a conversation with her, I felt like this would give me more insight and probably uh, help to put those missing pieces together.
After going through the New to Public Health program, has it helped support you in your role or in different projects at work?
Oh, yes. The New to Public Health program has helped me and has supported me definitely in my current role. It has helped me throughout the year in different goals that I needed to meet. Um, it's helped me do a better job and helped me to build confidence in my job performance, and has given me clear direction on which path to take for some of the goals that I needed to complete throughout the year. And I will say that the support of having expert opinions at your fingertips is makes it all better, and having a mentor there, having different people, from being able to be connected with different people from all around the world that have either been there, done that, or either still serving right now in the capacity that you're working in, really helps, and you don't feel alone. So it's definitely helped me. I've been able to call on several of my um, resident colleagues in different projects and different things that I've had, and they've been able to give their expert opinion on that. And then with the evidence-based project, it even helped me to foster relationships at work, because I went on a quest to um, find out about different areas within my organization and what their job roles were. And so I was able to connect with them and able to collaborate with them. And this also helped me to learn how everyone just kind of fits together. And so breaking down those silos are important in definitely in public health, but in any healthcare organization, because I think that sometimes we all get caught up in what our particular job roles are and our particular assignments, that we kind of forget that all of our pieces fit together for one common puzzle. And so, yeah, that's how it helped me.
Absolutely. And I think keeping in mind that we're all working together for that common goal of the community and helping the community. Um, would you like to share any of the work that you're currently doing?
Right now, we're still trying to get, you know, into the community meetings and different things like that, to bring more awareness. Uh, I work in the Office of Chronic Disease, so we do a lot of health education. And so we're working to bring more awareness on chronic diseases and different things like that into the communities. We are aware that the community can't always come to us. So it is our goal to make sure that we get into the communities and saturate the communities so we can start, just breaking down some of these silos where, this department is doing this and that department, this institution is doing this and that kind of thing. So that's what we're working on right now.
Great. Thank you so much, Mardie. Do you have any additional or last comments for our listeners or anything you would like to share before we go?
I think everyone should take a dive into public health, a deeper dive, I should say, whether employed in public health or not, just for the educational purposes and for understanding of how the systems work individually and together. I think that's the only way we'll be able to work together across these different sectors and bridge some of these gaps in order to reach that common goal of caring for our communities. Yeah, that's it.
Yes, thank you so much, Mardie. What you shared today has been so powerful, and I hope that you can continue doing the great work for the city of Houston and that ripples out into all of the state of Texas and the whole United States. So thank you so much for sharing. And we will look for great work from you in the future. Thank you for listening to Field Notes, Insights from N2 Public Health Alumni. For more information, visit N2PHealth.wisc.edu.